Hey everybody, thanks for watching. This lesson is an introduction to anatomic planes for CT imaging. We'll begin by talking about the anatomic position. All sectional imaging is described in terms of the standard anatomical position. In this position, the body is erect, the face is facing forward, the arms are relaxed to the sides, the palms of the hands are also facing forward, and the feet are pointed forward. All anatomic and directional terminology in CT is used as if the patient is in this position, even when they are not actually in this position. For example, the hand is always described as inferior to the elbow, even if the entire arm is raised over the head. Next, let's talk about body planes. Sectional images are routinely acquired and displayed according to one of the four fundamental planes of the body. The axial plane is a horizontal plane dividing the body into upper and lower portions, or you could say superior and inferior portions. Most CT images are initially acquired and reconstructed as a series of images in the axial plane. The next body plane is the sagittal plane. The sagittal plane is a vertical plane dividing the body into right and left portions. It's very common in CT to reformat images into the sagittal plane. The next body plane is the coronal plane. The coronal plane is a vertical plane dividing the body into anterior and posterior portions. Again, it's very common in CT to reformat images into the coronal plane. Finally, we can also use the oblique plane. The oblique plane is a plane that passes diagonally between any of the other planes. This plane is only used in CT when necessary to view special anatomic sections with a special orientation. Here are a few examples of what these planes look like in CT imaging. This series of images of the brain was reconstructed in the axial plane. Each image represents a section of the patient in the axial plane, in other words, moving up and down through the patient. Be sure you understand how these images are oriented. The top of the image is the anterior or front of the patient. The bottom of each image is the posterior side of the patient, that is, the back of the patient. The right side of each image in the axial plane is actually the left side of the patient, just like general radiography. And the left side of each image is the right side of the patient. But of course, we can also look at the patient in the coronal plane. This series of images of the brain was reformatted from the axial images into the coronal plane, which is very helpful when viewing a CT of the brain. Each image represents a section of the patient in the coronal plane, moving backwards and forwards through the patient. Again, the orientation of each image is important. The top of each image is the superior side of the patient, and the bottom of each image is the inferior side of the patient. The right side of the image is the left side of the patient, just like general radiography. And the left side of each image is actually the right side of the patient. And of course, we can also look at this scan of the brain in the sagittal plane. This series of images of the brain was reformatted from the axial images into the sagittal plane, which again is very helpful when viewing a CT of the brain. So each image represents a section of the patient in the sagittal plane, moving side to side through the patient. As always, the orientation of each image is very important to understand. The top of each image in the sagittal plane is still the superior side of the patient. The bottom of each image in the sagittal plane is still the inferior side of the patient. But now the right side of each image is actually the back of the head, in other words, the posterior side, and the left side of each image is actually the front of the head, or the anterior side. Here's an example of why these planes are so important. In CT, it's very common to create images in the axial and coronal and sagittal planes for the same scan. This greatly enhances the visibility of certain anatomies and pathologies. For example, in this CT angiography scan of the thoracic aorta, a large saccular aneurysm is well demonstrated in the axial and sagittal images, but is not as easily seen on the coronal images. planes. That's why body planes and positions are important in CT imaging. Thanks for watching.